Hi, I'm Alicia Marr. I'm the CEO of Excelin Health, and I have Danielle Johnson from one of our Excelin locations. You're the branch manager of our San Diego location, correct?
Correct.
Good. And Danielle, can you just kind of share with us your story about what brought you into home health and what makes you excited to come to work every day?
No problem. So to make a long story short, I started with home health actually 6 years ago on the East Coast. I was doing 3 different states. So I was doing Northern Virginia, DC, and Maryland, and I really enjoyed it. It was just a lot at that time, the traveling, the back and forth. And I always said if I ever got an opportunity where it was better structured and with a different opportunity, I would love to try again. So I went back to school. I got my nurse practitioner degree. I did some travel nursing. I worked with my NP for a while. Then I was just really looking for an opportunity to be in a managerial level situation. I've always wanted to have better impact on nursing and also more impact on patients. And so I actually applied for the clinical manager position, and when I came in, I was offered the branch director position. So it's amazing. And so what really wakes me up every day is the opportunity to work with our patients and our clinicians. And our team in San Diego is amazing. We have a really interesting dynamic here in San Diego where we have the really rich to the really poor. We have a really large homeless population that we're able to service, and we give to every year to the food banks and the pantries here in the community. We also have a very high military, as you are aware, military presence, which means a lot to me, being a military spouse and a daughter of military service members and granddaughter and brother. So it hits home in a lot of different ways, and it's been a pleasure, to be honest.
Well, great. Thank you so much. And we're excited to have you as part of our team. Can you share with me just some of the, aspects that you consider when you're setting the tone and the culture for your organization? It's so important for employees to feel like that they have a positive work environment, and they can feel valued and respected. So what are some of the things that are most important to you in your leadership space?
For my leadership space, the biggest thing is just making sure that we are a team and we are a family here. And we spend so much in milk, and we all know that healthcare bleeds into our work life, no matter how hard you try to have that work-life balance. And so it's really important for me from the top down for the team to know that we're all here for one another. We can all make it work together. And I think that's the biggest thing. We're all gonna have those days in healthcare where it's like, wow, that was a rough day, but at the end of the day, I want the team to feel like we were all there to support one another, to collaborate together, to make sure that we have the best outcomes for the patient, but the best outcomes for each other as well.
And then as you're speaking with potential candidates for employment, there's a lot of disruption right now in the workforce, especially coming off the pandemic. What are some of the selling points that you try to share with those potential employees that may be trying to tip their toe into the healthcare space of home health right now?
So the interesting thing is a lot of, I come from more of an acute background, and so being in the hospital, and it has been a shift where a lot of nurses have been burnt out in that space of being in the hospital for 12 hours and what that looks like, and they're looking for something different where they can be a caregiver and have a more flexible schedule. And so being able to kind of harp on some of those benefits that we have to say, hey, we can look at your schedule and make things more flexible, and do you need to come in as per diem, and then see how you like it, and how can we work with you to make sure that you are getting what you need as a clinician and we're getting what we need for our patients. We're looking at the outlet, those new candidates know that we're looking at you as a person. We want to make nursing fun again. We want you to have that patient care again, and we want you to feel that you're connected again. And I think that's what a lot of clinicians feel like they lost during the pandemic.
And I think so much of this space of business just affords itself so much flexibility, and autonomy in the workplace, but then also some opportunities for collaboration, and the schedule provides more work-life balance generally. So I think it's just in general that space of business is attractive to a diverse group of people.
It is.
That we have.
It is. And the autonomy of it, because sometimes when you're in the hospital, you feel that you're being micromanaged about there's things that you want to do for your patient, implement for your patient, and you don't have that flexibility, you don't have that space. And so this allows you to really practice to the full scope of your skills. I have LVNs and HODAs and CTs that really are a part of our interdisciplinary team. They're in our case conferences and they're able to put their input in, put their feedback in, and that's important because they have a wealth of knowledge.
You're the current branch manager of one of our advanced locations. We have different brands underneath the Excelin umbrella, and your location happens to be in San Diego.
Yes.
And earlier today we talked about, some specific items that set San Diego's advanced home health practice apart, you feel like, from most of the competition, but then also that's unique to our space of business under the Excelin. Can you just kind of share with me the ones that are the most important to you?
The ones that are most important to me, I would say, are definitely the veteran presence for sure here in San Diego. We are San Diego's most of their revenue, and about 1 out of every fifth person in San Diego is military or military associated. And so that's really important to me. And then also the space that we've been moving into. I'm from a more acute care background, and so I love being able to have that space that I can operate in and see those more acute level patients, and I'm starting to get that experience onto the home health nurses, and so that's really a field that I've really been enjoying. So we're seeing LVAD patients that normally a home health nurse would never touch, and we're able to live in a space that's, I think, growing with the way that Medicare is growing and healthcare is growing.
A huge push in pushing those more acute care patients into the home health setting. Still being able to drive great outcomes for a lower cost to the payer source, Medicare or private insurance.
And also giving the families back that dignity, right? I think with COVID, it saw a streamlining and a change in the processes and how we look at care in the hospital and what it looks like from home, and understanding, hey, some of these patients, we don't have to keep them in the hospital for forever. How can we give them back some of their dignity and their family space and make this a more comfortable situation for them, and to be honest, a more comfortable and cost-effective situation for the Medicare system and the healthcare system as a whole.
Right, absolutely. Well, thank you for your time, Danielle. It's been so nice visiting with you today and our visit out here this weekend. We again are just very grateful to have members like you as part of our team and leaders like you that champion the initiatives, for your patients. So thank you again.
Thank you.
All right.